I'm going to share my NBME shelf exam reviews. Hopefully I'll get that uploaded soon, but before then I'm going to upload these videos that I think you guys might find helpful. So let's talk about the step 3 exam. No, I'm skipping shelves. What exactly is the step 3 exam like? So it's basically a 2-day exam. Day 1 has 6 blocks, 1 hour per block, and each block is approximately 38 to 39 multiple choice questions for a total of approximately 232 multiple choice questions. Day 2 is 9 hours long, and it includes 6 blocks, and each block is approximately 45 minutes for a total of 180 multiple choice questions. On the second half of the day, you'll do 13 cases, and I explained in detail in another video what I mean by cases and CCS cases, so please check out that other video. It gives you a detailed explanation on it, and each case is about 10 to 20 minutes long. It depends on the case. And if you finish the case faster, like for example, if you have a 20-minute long case, but you finish it in 10 minutes, awesome, you're saving time. The audio got cut off here, but I was really saying that sometimes the cases will end early, and this may be indicative of the fact that you entered enough correct answers for the case to just close. So don't be surprised if the case just closes on you before your time is up for the case. You'll finish one case, and then you can decide to take a break or not, and that break is timed, of course, or you could just move right on to the second case. So the first day, a lot of people say it's similar to step 1 type of questions. The second day, it's like step 2 type of questions with some odd clinical type of questions mixed in between. And, you know, it's difficult to study for that. It's kind of like use your best judgment. Even I didn't really find a good resource to prepare myself for it. A question would be something like, patient with this type of condition at this level of severity, what dose of this type of medication should you give the patient and at which interval? And then I'll give you 600 milligrams Q 4 hours or 600 milligrams Q 8 hours or whatever. And it's kind of like you use your best judgment in that case. But I didn't find that my exam had very many of those questions. Everyone's exam is different, of course, and those type of questions encompassed only a small handful. But what you should definitely focus on are biostats. Definitely go over the drug ads on your UWorld Step 3 Q Bank. Also take a look at the ethics questions and have a sense of the different risk factors and prognoses for various conditions. Also know some of the preventative measures, vaccination series. You may also see some Step 1 type of questions on the exam as well. In my other video, I went over some of the resources that you can use to prepare yourself for the Step 3 exam. Just note that you will most likely have quite a few biostats questions. But again, everyone's exam is different, just to mentally prepare you all. But the second day of the Step 3 exam is mostly the case type questions. And when you go on ccscases.com, you'll see what I mean. And the second day, half of it is pretty much just like that. Pretty much the exact same format, nothing that surprising. Yeah, it looks kind of weird because for those of you who've already taken Step 1, Step 2, and the NBME exams, you'll notice that when you go to the Prometric Center, for some reason, they use this old type of font. It doesn't look very updated, but if that's the kind of thing that throws you off, I'm telling you right now so you can get into that mental space. But pretty much the formats, the buttons that you have to click are the same. Make sure you pace yourself accordingly, and before you go into the testing center, at least have an idea of when you're going to take your breaks. Of course, you can adjust accordingly. Maybe like during your exam, you might feel like, you know what, maybe I can do another block. I think I have enough energy for that. Or you might think to yourself, geez, I really need a break, or I need to use the restroom. So time yourself accordingly. Everybody's different.